Hello, and welcome to Epidemiology presentation assignment. My name is Nick Dennett. What the topic that I chose was to look at interventions for preventing hamstring injury, and more specifically, I examined a focus on eccentric strength training exercises. Why is hamstring injury relevant? Well, it's a common injury pathology seen in sports around the world, results in medical costs, missed competition, time out of work, as well as related pain and suffering. It's the number one most common injury seen in AFL players, and that's how I came to do the topic, through a general interest in sports physiotherapy. So the role of the physio is not just limited to injury management, but also it's important to be involved in the prevention of injury. And I thought this topic was interesting because even though there's a high incidence in sport, it's still not very well understood, as there's very little empirical evidence to support the effectiveness of different preventative interventions. So, I basically started my search at the Cochrane database. I typed in hamstring injury into the search. I came up with these two, and I chose to look at interventions. And that led me to this systematic review, which is a level 1 form of evidence according to the NHMRC protocols, evidence hierarchy protocols. And through this study, I found two that I thought were particularly interesting, and I found those through a search of the University of Canberra database. So I found my first one there, and then my second one here. Now, the systematic review was conducted by Goldman and colleagues, and it was quite comprehensive. Basically, they used an exhaustive search strategy, combed through a lot of different databases, and ended up with 7 randomly controlled trials, or quasi-randomly controlled trials, where a prevention intervention was compared to a control. Only 4 of these 7 targeted the hamstrings. Now the other 3 looked at the lower limb in general, and these had enough data on hamstrings for them to be able to fit the protocol that Goldman and colleagues had, the exclusion protocol. So the participants were mainly physically active young adults. There was a male bias in the study, and unfortunately that was what people had done studies on, physically active young males. A lot of sporting teams, basketball teams. There was obviously the AFL study, the soccer study, and one of them looked at runners as well. So now there was different interventions. The most common was eccentric strength training protocols. Another one looked at balance and proprioception. Another looked at manual manipulation. And there was one study that just looked at general injury awareness as an intervention. I mentioned the population bias, the male bias. A common thread throughout was the general lack of concealment of the control groups in the studies. So there was a lack of blinding, and that was due to the fact that a lot of these studies were conducted on sporting teams, so it was quite easy for individuals to find out which group their friends were in, for example. A lot of the studies came up with a lack of outcome data, and a fair bit of that came back to the fact that compliance was very low. Teams did not collect enough data. People in certain interventions didn't go through with it until the end. So yeah, there was quite a few problems, and they become clearer when we look at the individual studies. So this first one by Askling and colleagues generally was quite well designed, I thought. It's a level 2 source of evidence, randomly controlled trial. So it examined the effectiveness of a pre-season eccentric training protocol on the prevention of hamstring injury during the season. So basically looked at two soccer teams in Sweden, Premier League division. There were 30 participants in total. Whilst I mentioned here the study design was quite good, it was also marred by a lack of blinding, which was mentioned in the systematic review. Although the compliance in this study was very good, and that's probably due to the fact that they had a lot of resources on hand and they were only looking at 30 people in total. So what they did is they split up 15 people into an eccentric strength training program intervention group, and they completed 16 sessions. They tested pre and post isokinetic strength of the hamstrings and pre and post performance on a 30-metre sprint task, which was a good thing to do because then they got to see whether their intervention actually resulted in a change that was different from, say, for example, hamstring injury. And their control group, they kept them doing what they normally do, which is training with the team. So that was probably the best thing they could do. The results, they found less injury in the intervention group. But yeah, there were some limitations. Basically, 6 of the 13 players who sustained an injury had experienced a previous hamstring injury, and they didn't collect data on previous hamstring injuries in general throughout the two groups. So that's the reason why that could have skewed their data, is because previous injury is known as a very severe risk factor for re-injury of the hamstring. So perhaps they had less people in the intervention group with previous hamstring injury, and that's the only reason why they got the results they did. The study size was very small, probably too small to, make generalizations for the population, and that's something that they conceded that in future there's a need for larger randomized control trials. Again, that male population bias. Elite players, could have contributed to their compliance levels. They're more likely to want to conduct 16 eccentric strength training sessions. And again, as I mentioned, lack of blinding of the control and intervention group. Now, the third study was a level 2 source of evidence, or a randomized controlled trial. And they approached their study with the aim of expanding upon the findings of the previous study. So they recruited 220 participants, a much larger study. However, their participants were community level AFL players who were a lot different from elite athletes. And a result of that difference was perhaps a lower compliance. Only 46.7% in the intervention group completed the first 2 sessions. So you can see that that's not much of an intervention there. So they had 114 in the intervention group. The protocol was 5 sessions of a pre-season program carried out within 12 weeks. It consisted of some eccentric exercises. In the control group there was 106, and this group was an active control group whereby they conducted stretching and range of motion exercises. So they conducted a variety of stretches. The primary outcome they were looking at was the incidence of hamstring injury. They also looked at compliance with the intervention. So again, we experienced that lack of blinding. Conditions are very obvious with the teams participating, easy to know who is in what group. They did not test any pre or post strength or any differences, so they had no way of knowing whether their intervention resulted in any effect on the hamstrings. So also their control group was active. That could have possibly skewed their results. Basically what they found, they reported an effect when they considered the results in terms of the 46.7% that completed at least 2 interventions. Overall, when they looked at the data, there was no effect. So not a great result there. Recommendations for future research, probably more well thought out study design, try and implement blinding, probably better off having a passive control group, and testing pre and post results would be a good idea. Compliance, using any measures you can at your disposal to increase compliance would be good, as we know that wasn't very well done. And studies size, there's a need for larger, well-designed, randomized controlled trials to properly test the effectiveness of the interventions. There's references. Thanks for listening to my presentation.